Hey guys, welcome back to another episode of Nursing Uncharted. It's your host, Anne. Today, I want to talk to you about my personal experience in the NICU transport role. This is probably my favorite thing I've done in my nursing career thus far. So I thought it would be fun if I shared my experience with you guys. So, I was a NICU transport nurse for roughly 5 years, but the first year of that was orientation. It was a brutal orientation, brutal in a good way. I learned so much. I was in the NICU for like 3.5, 4 years prior to orienting to the NICU transport role. I actually had the title of Neonatal Stabilization Specialist, which sounds pretty cool. So we'll go with that. But for ease of the tongue, we'll call it NICU transport nurse. So when I got hired, the practice of that was a year-long orientation. We say year because you don't know how often you're going to get your I'm blanking on my word, when you're going to get your procedures. There was procedures that we had to be signed off on to be able to be competent to go out on the field to other hospitals or even in our own hospital to perform these tasks independently. What I loved most about this role is I got to function higher as a nurse than I ever thought I would be able to without having to further my degree. So the first part of the orientation was the didactic with the doctor. So we would sit in a room. There's only a couple of us on orientation at a time, just so everyone had a fair shot. But we would sit in our conference room with the doctors, and they would go over the, different diagnoses in such depth that even though I was a NICU nurse for almost 5 years before this, I learned a tremendous amount, just learning the fundamentals, the pathophysiology, how to initiate the first steps of resuscitation if a baby presented with these symptoms. It was so valuable. And I had spoke previously in an episode about having like this pocket guide or like a NICU transport protocol book, and I would take notes in there, and I had such amazing notes, and I kicked myself for not having that. I actually had my mom, I called her the other day when I was preparing for this episode to be like, can you go to the storage unit to see if maybe I left it in there, but I don't think I did. So pivoting for a second, don't throw away your notes because you will kick yourself, because I kick myself every day for not having that book. But that book was my Bible during my transport days. It had everything I needed to know, and it was kind of something I was proud of, because I'm like, I never thought I would be able to understand, a cyanotic heart lesion or the pathway of blood, how it goes through the heart for pulmonary hypertension, or if you have, I don't want to get too in depth with NICU terms, but I never thought I would be able to rattle that off as easily as I do. And I can do that because of the didactic classes I had with the neonatologists. I was learning things on their level with what they would teach their residents. And it was cool. It was kind of like med school, but accelerated. So that was part of my orientation. The other part of the orientation was getting experience with those procedures. Those procedures were endotracheal intubations. We would needle aspirate pneumothoraces. We would place central umbilical lines, so UV lines, UA lines. And then we did like venous stick. They were saphenous sticks. I don't even know if we still do those anymore. But then we also were trained to do arterial sticks, that one has become a common practice for bedside nurses in the NICU. But the other things are not skills that a bedside nurse has unless you go through, this type of training. But again, it wasn't schooling. It was training within the hospital from the physicians, from the NNPs, and from the PAs. So it was pretty cool to be able to do that for lack of better words. That's just what it was. It was cool. And I was proud of myself and I was proud of the things I could do. And I'm excited because that opportunity recently may present itself in the future for me. And that's exciting. So more to come with that. But, with transport, once you would get, I think we had to do 6 successful intubations. We had to place lines. We had to do the needling of the chest for a pneumothorax. And a lot of those tasks we got to do on babies in the unit. But again, we were competing with residents. We were competing with our NNPs and our PAs because everyone has to stay competent. So on top of learning how to do them and being signed off on how to do them, you also had to maintain a yearly competency of maintaining those skills. So we did have to perform some of those skills on sim dolls, but most of the time we were able to do them on an actual patient. And sometimes that was like in the field, when we're by ourselves. So, it was such an amazing experience. And to this day, even this morning, I was on Facebook looking at some of my old teammates that are still doing it. And it's just like, it's really amazing to see. And I miss those days, and I miss those girls, and I miss my lifelike crew that taught me so much that I didn't know about, pre-hospital RN and practicing in the field and being outside of your comfort zone of your own, 4 walls of your home unit. So, just there's so many takeaways from my experience, and I just wanted to share that with you because it holds such a good or a dear place in my heart. And if there's an opportunity for you to do anything like that in your career, I challenge you to take that risk, because even if you realize it's not good for you, the education and the knowledge and just the ability to do those things is something that you can look back on and be proud of yourself. And that, again, that goes to show like what nursing has to offer you. We are able to do so many things like beyond what you learn in school. I never thought this was an opportunity for me when I was in nursing school. No one ever talked about NICU, let alone NICU transport or flight nursing. I had no idea. So it's amazing what nursing can do for you. But when I went out on my first transport with my girl Heidi. I'll have to send this episode to you, Heidi, so you can listen to this story, and hopefully it brings back memories just like it does for me. But I'm from middle of nowhere, Pennsylvania. Bringing that back. Let me set the environment for you. Huge Amish population, and Amish are self-pay. So this is they usually don't use a helicopter to go pick up a baby or even, an adult patient or pediatric patient, just because it costs a lot to fly in a helicopter. So a lot of times it would be by ground, but this is like one of my first transports. I think it was my first one. I know it was my first intubation attempt. But we get our doctor comes, we're going to this town notorious for Amish population, and we're going to go get this 27-weeker. And at this point, I am crapping my pants because I'm like, what? I'm going to do what? In a helicopter? I don't even think I went by ground yet. So, I was just like, it was like the scariest but most exciting adrenaline rushing experience for me. But Heidi, I respect you to this day. And I was so grateful that you were able to give me that first transport experience, because we had a relationship where I felt comfortable with you, and I knew that you would be hard on me and you would push me, and you did all of those things plus. But we go to this place. It was about a 30-minute flight. So it's a little over an hour and a half by ground. I guess an hour and a half. So it was like 30 minutes. Got to get my flight suit on, do all my stuff. And a lot of times we would fly there, but we would drive back because you only charge for loaded miles, meaning if there's a patient on board, that's what gets charged to insurance, but whatever. So we flew there, and then little to our surprise, we were going to fly back with this 27-week Amish baby. And we get there, the baby needed intubated because the pediatrician at the hospital did not feel comfortable with that. So I try, she lets me try. I couldn't get it. I'll own it. I couldn't get it, but it was my first like real time on a human trying to put a breathing tube in. So it was nice to see. And then Heidi did it. She like made it so I could see what she did. I even think I put the tube in while she found, the correct placement. So that was a really cool experience. And the family called us the helicopter girls because like that's just what she called. So we brought her baby back to our NICU, and to the day that she was discharged, she called us the helicopter girls in her accent. And if you know anything about the Amish population, you can't take photos. They don't like their photos taken. So at her discharge day, Heidi and I were working that day, and she asked for a picture of Heidi and I, which I thought was interesting because I was like, oh, you're allowed to take pictures of us, but they took a picture of us, and I hope I hope they still remember us. But yeah, we were known as the helicopter girls. And that was like one of my very first, I think it was my first transport, definitely first flight and first intubation attempt. So that will be a memory that I will hold on to forever. And it just makes me laugh because of how she said it and just the whole scenario of it. It's a really happy, great ending story that the mother was even involved in some of the humor. So that's something I'll cherish forever. But that's just one thing that happened. I went out on numerous transports. Not all were happy, not all were good. I will say 99% of the time I brought back the babies. I went on one transport. It was one of my last transports that I went to get a baby who fell asleep. Mom fell asleep while breastfeeding, so the baby was asphyxiated. And the hospital, it was winter, Pennsylvania ice storm, just set that tone. And the hospital couldn't intubate the baby, so couldn't put a breathing tube in the baby. And it was the middle of the night, and I was sent out with like literally a ripped off piece of paper from my doctor who was just woken up and said, "This is all I have. Just get there." And so I'm in the back of an ambulance because it was like snowing, sleeting, ice. And the Lifeline team that was at the hospital that I worked at, we were very safe. So we didn't take any chances. We didn't fly under any precaution with weather. Like if it was a weather issue, we always went by ground, meaning ambulance. So I had to go by ground in an ambulance. I'll kind of give you a little backstory. We had just gotten a new ambulance with a new stretcher that only fit in this ambulance. So that's important later on in this story. So we go, that trip is about 45 to 50 minutes. And I get a call from my charge nurse in the back of the ambulance. And she, I won't name her just for that purpose, but I love you because this was the scariest moment and you just made it the most calm as possible. She was like, "Hi, Anne. How far are you from the hospital?" And so I asked them, I'm like, because I don't know where I am. I'm in the back of an ambulance trying not to get sick. So they're like, about 20 minutes. And she's like, "Okay, well, they wanted you to get there as fast as you can because the blood gas was 6.8 and blah, blah, blah. I won't give you the values because it won't matter to some of you, but it was bad. It was not compatible with life. So I then had to go lights and sirens in a ice storm with a very green Lifeline team. So meaning new. And I was trying to prepare myself because you have no idea what you're walking into. Like you come in and they look at you to be a savior. And I have to evaluate, okay, where's the baby? Where are we at? What's going on? What have we done? What do we still need to do? Blah, blah, blah. So I get there. They were able to put a breathing tube in, but it was way too small for the baby. They were unable to get an oxygen saturation. The baby was gray. It was not a good scenario. So first thing I did was establish a better airway. So I intubated the baby. X-ray was waiting for me to verify placement. I backed up. I smashed my head off the X-ray machine. This is how traumatizing this transport was for me because I remember every detail. I smashed my head off the X-ray machine. Tube was in good placement, still couldn't get any perfusion to the lower extremities. I had no idea if this was a cardiac kit on top of, the accident that had just happened, blah, blah, blah. So but at this point, I was on the phone with my doctor and, they were switching out. So they had one doctor was leaving and another one was coming in, which that was weird. I don't know why that timing was that way. Or maybe I left in the evening and then they switched out once I got to the hospital. But anyways, I was having to talk to two different physicians at that point. So on the phone, they said the transfer center just said that they have a window to fly. And I was like, perfect. This kid needs to go. So at that point, it was like, okay, let's get out of here. So we load the kid in the isolette. Remember back when I said that we got a new ambulance with a new isolette and stretcher? Yeah, that stretcher doesn't fit in a helicopter. So I had to wait for the helicopter to get to me to move the kid to another isolette. Did all that. Load the kid in the helicopter, pulling up dopamine in the back of the helicopter, lift about 4 feet off the ground, and the pilot's like, I can't fly. I lost visual. So I had to land back down. At this point, was like at my wit's end. I couldn't. I was about to cry, but couldn't cry because I didn't have time to cry. So I was like, let's just go. And they were like, we can't. This stretcher doesn't fit in the ambulance. So I said, take me to the ER, find me a trauma bay. I need to just do this as quickly as possible. So again, I have to transfer this kid to another isolette, put in the back of an ambulance, and get the heck home. The long story short of this scenario is that baby went home bottle feeding. So his life was saved, even though my life was forever affected by this horrible night, winter night in Pennsylvania. But, those are the stressors. Sorry, I kind of went off on a tangent with that story, but, that just sets the idea of like what I went through and like why maybe you can understand I needed a little break from transport because it's joyful and great and you're proud of yourself because you're doing all these fun tasks, but then you forget why you do the tasks because these babies are sick and things happen. And this was a really awful experience. And, I get back and there's only so much you can do in the air, on the ground, at other hospitals that don't have a NICU because you're going there because they can't care for the baby. So when that baby got back to our unit, we had a different ventilator set up for him. We had nitric ready, and then the kid was actually placed on ECMO. So none of those things I could do on transport. So, even though it's like, okay, yes, that was a crazy, awful experience, I kind of aided in saving his life. So that's pretty cool. And I was able to do that, on my own with like my nursing judgment, making those decisions and my skills that I spent a year in orientation learning how to do. I was able to implement that under really stressful conditions. But, there's only two bad stories I have. That's one of them. The other bad story, unfortunately, I didn't bring the patient back with me, which when I said 99% of the time they come back, that was one. It was pretty terrible, but that was the first time that's ever happened to me. And the Life Flight crew that you're with. So, Life Flight is pre-hospital. So they respond to, MVAs and, they'll go pick up at other hospitals, but they have to hit the ground, fields, wherever a helicopter can land to, save lives. So they experience a lot of dark days more than I did as a NICU nurse. So when I had to go through that time where I was unable to bring a patient back to our hospital, they were there for me. I didn't want to go home. I didn't want to go home alone. And that's a feeling that I hope a lot of people don't experience, because it's weird. You almost feel like a failure. You almost feel like, what could I have done? And you do, like, everything going through your head is, what could I, shoulda, coulda, woulda done, right? Those are all the things. And I didn't know how to cope with that. So I was grateful to be with the team that day. And it was a team that I didn't go out with that much. We had multiple different bases, and this was a base that they weren't our go-to calls for NICU. So they didn't have as much experience with babies as like other people. And so I didn't really know them on a personal level like I did my Life Flight 1 team. So we didn't say much. We just got in the helicopter, and I think they were kind of waiting for me to talk, but I like didn't know what to say. And I think one of the first things I said was, did I miss something? And then that kind of opened the door, and it was like they were waiting for me to allow them to help me deal with what just happened. So we went back to their base and we sat around a table. I cried, they cried, because I think it was their first experience with that too. And, in that situation. So we all just took an hour to deal. And I didn't feel guilty. I needed that, because to walk in my home unit alone with an empty isolette was a feeling that I was not prepared to deal with. And I was so grateful for them. And if it wouldn't have been with them, I don't think I would have been able to get through that. And that was in the middle of my transport career. So I didn't quit after that. I didn't step away, and I didn't quit the transport team. I actually left the NICU altogether for like a year and a half before starting to travel. But, that had nothing to do with why I stepped away. It happens. Like, these are the sad times of being a nurse. And, it's all exciting to sign up to do this fun, cool, like I said, cool, thing in nursing. But there's some dark times, and you don't expect it. You don't think that's ever going to happen to you. And it did happen to me. But the Life Flight crew they knew how to deal with me, and they knew the stress management because they've gone through it on a different level. So they had the training and the experience and the resources, because being a pre-hospital RN and a Life Flight rescue team, they have those like critical stress management courses, and it's a little bit more in depth than what you get as a bedside nurse, because you're not on your own dealing with that stuff. So they were able to help facilitate that grieving process and that coping process for me. And I'm grateful for that. And like I said, they weren't my Life Flight 1 team, and probably no one knows what that is, but we had 5 or 6 bases. I can't remember now. But we always went out with Life Flight 1 and Life Flight 5, and they were not one of those 2 bases. So they didn't know me. That was the first time I met one of them. So they didn't know me from anything, and they still protected me and made sure I was okay. And I'm very grateful for that. With my Life Flight 1 team, I have to bring this up because I was able to convince one of them to come on this show in the future. So I'm very excited for you guys to meet this person that actually played a huge part in my success as a transport nurse. We deal with a lot of, like I just explained, a lot of tough times, and a way to get through that for me is humor. I've mentioned that before in some of my episodes, just that I use that, I find an opportunity for it. I don't just make humor every time, but if there's an opportunity for it, it kind of lightens the mood for me, and I think it helps a lot of people. So one of my Life Flight 1 team, and I shouldn't even say one of, because Richie was the cream of the crop. He really was, he's one of the best mentors I've ever experienced and ever met. And it's not just to me. He takes everyone that he meets and that comes under his into his base and into his department. He takes them under his wing and just makes them thrive. And I think that's why I really am excited for him to come on and talk with you guys, because he just brings this motivation and, power and love for what he does, and he wants that for everyone. So I think I'm so excited for him to come on. But he and I and Scott, we called ourselves the A team. we were the A team, and I actually wore them yesterday. It's so funny, I still have them, but I bought like fun socks, like fun compression socks. And when you're in the helicopter going to the patient, that is the most stressful time of that experience, because you don't know what's going to happen and you're just preparing yourself. And like, we had little like worksheets that we would put all of our emergency meds, fluids. We would calculate that all on the way there. So that way, like when we got there, I could hand that off to one of them and they could start drawing up the medications if I needed, or get me my fluids, know what size ET tube I needed, just having like a plan in place for no idea what the plan was going to be. So you just kind of had somewhere to start with. So, that was something I'd always like try to focus on. But on those long flights, and you're just like, and if you're flying, they're sick. So you're not just flying to get someone that for them, you're not going to get a broken leg. I'm going for babies that are in respiratory distress, are in, cardiogenic shock. I'm going for these sick kids that have minutes, that matter. So, it's not just like, oh, la da da, this is great. So you're stressed. And I say the A team because Scott and Richie, they knew, we got to know each other. So they knew I would always be like ready to throw up at any second because of my nerves. And we would just find things to talk about. And one of the things were my socks, my fun glow in the dark socks, because there was a fun light you could put on in the back of the helicopter that was blue, and our socks would like glow. So then it was like a fun thing that we would all wear fun socks. And we never knew when we were going to work together, because you don't know when a baby's going to be sick. So it just became this thing that makes sure I have fun socks in case I go out on a NICU transport. So, just those lighthearted fun things to look forward to when you're scared out of your mind going to get a baby that you don't know what's going to happen, and could be one of those scenarios that I just told you about. So, I'm excited. I don't want to give too many of our stories away, because I want Richie to kind of do that with me and we can reminisce, because it's been a minute since I've seen him. But, he's someone to look forward to, and you should definitely tune into, because he's going to give you some good tips, especially if you're looking for that transport nurse experience or life flight pre-hospital. He's gonna come in with some amazing tips. But I hope that wasn't too scary. I hope it kind of shows what this podcast stands for, the real and raw. The raw is not always good. It's not this bragging story that you can talk about. It's the tough things. And, I'm not the only person that went through that. So I really hope someone out there listens to this. And if you're having a bad day, share in that. I've had a bad day and I felt like I could have done better, or just being sad. You're not alone. You're not alone being sad about what happens as a nurse. We see terrible things every day, and we have to go home to our families, go home to our loved ones, go home to our animals, and just be ourselves again after experiencing trauma. So, that's what I want from this. That's my hope for this podcast, is to unite this community, and we can just rally around one another and share these stories and bond and connect over them. Because really that's what this is about. So yeah, that's about it. Most of my transports were happy. Okay, don't get me wrong. They were great. Babies went home with their families. You'd never know. The only people that have those memories are the parents, because the babies are alive, thriving, and doing well. So it's not always sad. Sometimes it is, but that's the real and raw, and that's why we're here. So I hope you enjoyed, and I will see you guys soon. Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.